This is Kelsey Browning, and I did question number 1 on the role of the BSN nurse in leadership skills slide. For number 1, nurses can play a significant role in help preventing hospital-acquired pneumonia from occurring. Nurses need to lead the way in the design and implementation of policies that allow for adequate time, proper oral care supplies, ease of access to supplies, clear procedures, and outcome monitoring, ensuring that patients are protected from hospital-acquired pneumonia. Additionally, in order for a change to happen, nurses should 1. Be educated on how to prevent hospital-acquired pneumonia and the risk factors for patients more prone to the infection. 2. Clean hands before and after patient interaction. 3. Provide frequent oral care to reduce the amount of bacteria in the mouth. 4. Head of bed elevation at least 30 degrees when safe and appropriate to reduce the chance of germs from the mouth getting into the lungs. 5. Clean suction technique and closed suction catheters. Both of these decrease the chance of outside germs entering a patient's lungs. 6. Partnership. Working with other staff members to make sure everyone is providing the same care mentioned above. 7. Speak up. Say something if you notice a family, friend, or other staff member that did not wash their hands before touching the patient.
Hello, my name is Lauren Larkins, and I did number 2 on the role of the BSN nurse in leadership skills slide. Number 2, the RN monitoring the impact of change should see a decrease in incidence of HAP. The nurse would be looking for a trend in the HAP incidence on their unit. RNs and their unlicensed assisted personnel caring for patients on a progressive care unit, a stroke unit, and 2 medical units attended a training session with content that included the following: impact of HAP on patients and families, the role of the RN and UAP in HAP prevention, step-by-step review of the oral care program, electronic medical record documentation, and demonstrated use of the oral hygiene kit. The technology the RN could use would be, for example, the number of incidents reports regarding HAP, the patient's EHR, and the dashboards created in the unit for HAP.
This is Monica Vidal, and now we will be discussing the role of informatics and nursing. The role of informatics is pivotal in the evolving practice interventions for the prevention of hospital-acquired pneumonia, prevention and treatment for hospital-acquired pneumonia. Informatics is used in reporting infections, which in turn leads to increased emphasis on infection prevention across the continuum of care. Implementation of electronic health records aid in recording and identifying significant risk factors in patients, allowing for preventative strategies. Collecting important data and keeping surveillance ultimately results in more favorable outcomes for the care provider and for the patient, as the information gathered allows for improvement and prevention. Informatics can be used in all aspects of healthcare, from the initial check-in to the final bill. Keeping records that can be accessed by the different aspects of the healthcare team promotes a conducive environment for more timely and effective treatment. Also, in minimizing the risk of inaccurate or incomplete information, allows for better informed treatment team and hence better care. And lastly, accurate itemization of the procedures and the care rendered allows for a streamlined process between provider, insurance, and patient. Of the procedures and the care rendered allows for a streamlined, accurate itemization.
This is Avery Wills, and I'm going to be reading number 3 and 4 for the slide, informatics and nursing.
And the care rendered.
For number 3, we put that data mining goal of this challenge is to submit a list of patients ordered according to their probability of contracting nosocomial pneumonia. The patient with the highest probability of contracting NP was ranked first. As a consequence, the patient should be more closely supervised by health managers as they represent a higher risk of contracting NP. Data mining is a promising approach for solving this problem because it can handle large numbers of observations, variables, outliners, unbalanced data sets, and overfitting while being highly accurate as well. For number 4, we put that one recommendation we think would be useful would be using the EHR to chart potential risk factors for pneumonia patients, as well as charting all the necessary information in order to keep track of whether or not the implementations are working smoothly.
Okay, so for the summary, the first question was, what is the role of performance measures? Performance measures are designed to measure systems of care and are derived from clinical or practice guidelines. Data that is defined into specific measurable elements provides an organization with a meter to measure the quality of its care, to identify improvements that need to be made, and to form goals to make an organization work at its best. For question 2, it was, why is observing for performance deficient important? One of the articles I found that said, distinguish what appears to be happening from what really is happening. So you can always believe whatever anyone said, but it's important to see what's actually happening to know what to fix. And there's always room for improvement, and in order to improve an organization, one must know what needs to be fixed. Deficiencies have to be observed in order to set goals for individuals and the organization as a whole, while gathering feedback on the interventions to make progress towards reaching their goals.
This is Kelsey Browning, and I did number 3 on the summary slide. For number 3, using best practices can improve the deficit by reducing the number of incidents of healthcare-acquired pneumonia. Healthcare-acquired pneumonia is an underreported and understudied complication of hospitalization with significant patient morbidity and mortality. It's responsible for increases in hospital costs, lengths of stay, and discharges to long-term care facilities. By using best practices, we can reduce the issues that arise from healthcare-acquired pneumonia.
Hello, my name is Lauren Larkins, and I did number 4 on the summary slide. Number 4, the financial implication for hospitals is to reduce the cost of care in incidents of healthcare-acquired pneumonia. Due to HAP being preventable, hospitals receive minimum to no funding related to the infection. Therefore, it is important to ensure providing proper education to staff members and implementation of procedure to reduce HAP, such as hand hygiene, aiding or providing oral care, promoting the use of incentive thermometry, and raising the head of the bed to 30 to 40 degrees.